Commissioners Court come to order. It is the regular meeting, the last meeting of 2020. 2020 is almost over with, thank goodness. It's Tuesday, the 22nd day of December, 2020, 9:30 a.m. County Courtroom, Anahuac, Texas. It's a virtual meeting, and I need us to remember Craig Stengler, a longtime county employee, passed away this week. He retired like 7-8 years ago. So Craig Stengler, and also our previous state rep, Mark Stiles, and his son Ross. Commissioner Gore called me earlier, and he had a boating accident. He was duck hunting over in Louisiana, and he's not doing very well. So we need to remember those two in prayer.
Wow.
So if you'll all rise. Gracious Heavenly Father, we thank you for this day. We thank you for this year. And we're thankful that it's almost over with. Lord, we thank you for Gary and what he's meant to us for 14 years as county commissioner, and what a friend he's been to all of us and to Chambers County. Pray for those two, Craig Stengler and Mark and Ross Stiles. Be with them, heal them, protect us as we go through this agenda today. And just remember, pray. Amen. Join us in the pledges. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag.
Pledge allegiance
to thee, Texas, one state, under God,
one and indivisible.
God bless you. Billy, Patricia's doing okay?
She's doing okay. I hope we'll pick her up. I may have to bail out early, so if I go.
I'll cover you, Commissioner.
All right. Appreciate that. I just want to make sure that I give Gary my best and tell him how much I've enjoyed working on the court with you. Really do.
Thank you, Billy. Same here. Appreciate it.
Yes, without question. Gary, I've enjoyed it too, but more so, thank you for the resource you've been to this rookie commissioner. And I'll always have a debt of gratitude for all you've done to make me to be the best I can be, and I appreciate you.
And I'll tell you right now, I was not looking forward to our next disaster. It seemed like we're coming too often.
Way too often.
Yeah. We need to calm down for just a little while.
Jimmy, do you have anything you want to say for the Love Fest?
I mean, Gary's been a very good mentor to me, and I'm greatly appreciated, and he will be greatly missed.
Greatly.
I think you're hard-headed, you're a Grinch, but I still love you.
I did not wear my socks today.
You didn't wear your Grinch socks I gave you yesterday?
No,
yeah, you heard the last of it. I said I still love you, though, brother. All right, since we're on the Love Fest, I'm gonna go ahead and go to 1-4. Discuss and consider resolution recognizing Commissioner Precinct 3, Gary Nelson, for his service to Chambers County. Aaron Thomas is requested to read it.
Of course he is, right, Commissioner Nelson?
That's correct.
Hey, Gary, is this the same one we read yesterday?
I was hoping it was different, but I don't know. That was pretty tough yesterday.
Better you than me.
All right. Be it remembered at a regular meeting of the Commissioners Court of Chambers County, Texas, on the 22nd day of December 2020, the following resolution was adopted. Whereas the Chambers County Commissioners Court takes special notice when an individual has given long and faithful service to the furthering and improvement of Chambers County, Texas. And whereas Chambers County Commissioner Gary Nelson was born on September 16th, 1958 in Baytown, Texas, and has been a resident of Chambers County for the majority of his life. And whereas Commissioner Nelson attended Barbers Hill High School until his junior year, when he transferred to Uvalde High School, from which he graduated in 1975. And whereas Commissioner Nelson graduated from Southern Methodist University in Dallas, Texas in 1979, earning degrees in real estate, mortgage banking, and a bachelor's degree in business administration. And whereas upon his graduation from SMU, Commissioner Nelson returned to Chambers County and began farming rice before expanding to hay and cattle operations. And whereas Commissioner Nelson married his wife Sandy in 1981, and together they raised 3 children: Trish, Joseph, husband Joel, Kim Short, husband Stephen, and Ray Nelson's wife Cindy, and now have 8 grandchildren. And whereas Commissioner Nelson has served Chambers County honorably and diligently for many years, sacrificing time away from his family, his own interest, and whereas Commissioner Nelson will retire as Chambers County Commissioner of Precinct 3 on December 31st, 2020, and plans to spend time with his wife Sandy, relaxing at the farm and family ranch, fishing and traveling when it is safe to do so. Now therefore be it resolved that the Chambers County Commissioners Court does hereby recognize and extend sincere appreciation to Gary Nelson for his hard work and dedication to the people of Chambers County. During his time as commissioner, he has provided much comic relief with his fiscal conservatism and many made-up words. The people of Chambers County and members of Chambers County Commissioner Court extends deep gratitude to Commissioner Nelson and wish him well in his next chapter in life.
Right.
Motion to approve.
Nelson,
Move on.
I'll second that.
second by the rest of the court. How about that?
Yes, there you
By
go,
Commissioner Nelson,
Judge.
second by Commissioners Court. And all those in favor?
Aye.
Aye.
Aye. Thank you, Aaron. Thank you, Gary. Seriously, this is your last court, and I've enjoyed working with you, brother.
Hey, I might ought to put together a dictionary for those words that I make up,
That would be nice.
And Gary, I just think you just got that SMU brain, and Mary Beth probably will agree. You maybe using words that throw.
Hey, they just got burned up. They burned up when I was up there.
That's that football brain. That's what my wife tells me. It's a football brain, Gary.
Yeah.
Any citizens' comments? No citizens' comments. 1.1, discuss and consider department update. That would be the health department. Mary Beth, good morning.
Good morning. So Commissioner Nelson, I will say that I have been on the receiving end of many of your colorful words, meaning one of them that has to do with the pandemic, meaning the epidemiologist, which has to do with epidemiology. So
I put that in the resolution.
I'm glad you remember.
well, we did. So thank you for helping us get an epidemiologist a couple of years ago. So
You're welcome. You're welcome.
okay, so I'm going to attempt to share the screen, and this will take me just a little bit. The public health department, as y'all know, has grown over the past several years, and I wanted to give due time to all the different functions we have in the health department. So Austin told me how to do this, so I am going to attempt to share my screen.
And Mary Beth, you might remind them, because most of them weren't here, that in the past we did not have a health department.
So when I was hired, can y'all see my screen right now?
Yes, ma'am.
So I was hired in 2007, and I took over the health department, I want to say in 2013. And we had a very basic health department, and we've grown it since then. In 2013, we also took over the Public Health Emergency Preparedness Grant, which allowed us to grow our emergency preparedness program, which also has allowed us to, I guess, respond to the hurricanes and the pandemic and the capacity we are currently. So, okay, so I'm just going to jump right into this. So thank you for the opportunity to allowing me to be able to share this with y'all today and focus on our amazing team that we have put together right now. There's 10 essential functions of public health, and basically this outlines them. I'm not going to read them to you. I know you all know how to read, but basically what it is that our main goal in public health is to just protect and promote and assess the health of our population in Chambers County, which is what we're required to do, and also what the county in Title II of Health and Safety Code is responsible for doing for Chambers County. And so that's what we're responsible for. And in 2007 is much different, and in 2020 as to where we are now and our ability and our capability to respond in that aspect. So moving forward, we can see how much we've grown. First, I'll just start with Shalonda Cooper. She's our public health nurse. What she mostly takes care of on a day-to-day basis is our immunization services. She takes care of the Texas Vaccine for Children, Adult Safety Net program, influenza, all of our immunizations, community outreach, HIV, STD, STI screenings, tuberculosis, and women's health screenings. She's very active in that role. These are some numbers from this year as far as the vaccinations for children. It's broken down by a region in the county, Anahuac, Winnie, Mont Bellevue. You can see the immunizations there. Influenza, we've given 425 immunizations to date. Community outreach, you can see we do vaccination drives, education in the schools, AgriLife partnerships, and we do meet with a lot of committees to bridge the gaps to access to care in the county. STD screenings, we do that. It's free to the community, and you can see in 2019 and 2020 the breakdown of the STD screenings. Tuberculosis, we're also mandated by the state to follow all those TB cases, and Shalonda has actively monitored several throughout the year this year. And then women's health, we also do free pregnancy, or there's pregnancy screenings here in the county. So a lot of the things that I'm going to talk about also are through our public health emergency preparedness program. And basically that started after 9/11. The CDC saw that the country was not prepared for an attack that happened on that large of a scale. So basically what they did was the CDC gave state funding to different jurisdictions that would like to have that preparedness program. In 2013, we took over our preparedness grant funding. We were very minimally funded, but we did all the work that larger jurisdictions did. And since that time, we've grown our grant funding. And so you can see, I'm going to try to minimize because I'm looking at myself over here. You can see that then in 2011 versus now, how prepared we are now. This is throughout the United States, whether they can mobilize staff, have an incident command system, could have a pod dispensing site, or have sufficient storage. You can see where they were now and where we are then versus now. So these are all the FEP capabilities, the public health emergency preparedness capabilities. These are things we strive at all the time. And a lot of these things go hand in hand. Kevin, as you know, we took him from the state in 2016, and he's continued to grow our program. So these are a lot of what are called capabilities that we work on throughout the year. One of the main focuses of our FEP program currently that we're working towards is our epidemiology program that you'll know, and that we're currently in COVID, but this is something that we monitor year round. These are reportable conditions that we are required to monitor through the state, and these help us detect and respond to communicable diseases throughout the county. And we do active surveillance, as well as we work with the schools and compile data, and we respond, as well as keep our elected officials and community partners updated on any kind of infectious diseases that may be circulating through the community. So these are notifiable conditions in Texas. These are all the reportable conditions that healthcare providers, schools, administrators, any kind of healthcare provider, they're required to report to the local health department within a certain time frame. 18 of them, they must call us immediately, and 15 of them, they must call us within 1 day. What I have listed out to the side in yellow are all the ones that we typically investigate. Some of them are very rare, and some of them are pretty common, but these are all the ones that require us to investigate and then turn a report over to the state. So these are all the ones that typically we respond and investigate throughout the year. So this is a breakdown of our case investigations from 2010 all the way to 2020. So what we tried to do was 2010 to 2015. This is basically what we did was we forwarded this to the region. This was really before we even had a program. And so the region basically investigated these cases for us. And we know that a lot was being missed and was slipping through the cracks. 2016 to 2017, our program was kind of in its infancy, and we began performing some epi case work here on our own. And Dr. Lynn at the region, that head epidemiologist, gave me a phone call and said, you have your own PhET program. Y'all need to start doing this yourself. So you can see in 2018, our cases really picked up. We started reaching out to our local healthcare providers and said, you really need to start reporting these diseases to us. And we gave them a lot of education. 2019, 2020, you can see, of course, in 2020, we've included all of our COVID-19 epi investigations, which is why it's at 2,800. Influenza is not a reportable condition. Everyone likes to compare the flu to COVID-19, but it's not a reportable condition. But we realize how important flu surveillance is throughout the community. So we do track the flu. The state encourages us to track this. So we have great partnerships with the schools and all of our local healthcare providers, and they do report this to us weekly. It starts in November and it runs through, I think, maybe April. And so you can see it's grouped by years because it does cross over years. 2017 to 2018, we have influenza-like illness, or it's called ILI. In Chambers County, we had 11,251. Flu A, 1620, flu B. And then you can see jumping forward in 2019, 2020. But again, in 2020, we just started our flu season, 7399, flu A, flu B. And so we will continue reporting that or tracking that throughout the year. We report this to DSHS every week. We've also tried to report this on our Facebook page as time allows. COVID investigations, we've tracked 2,500 case investigations, have actively investigated those. 8,000 people in the county have been placed on quarantine, that's estimated. We've assisted 120 families through the Houston Food Bank and water deliveries to people who've only been able to stay at home. We've reviewed over 15,000 labs. We've transferred 200 out of jurisdiction cases. We've triaged 2,000 phone calls about here. That's up front, that's not back in the back. We've made about 500 social media posts, too many meetings to count, and we prioritize schools, nursing home, jail, daycare, and business facility case investigations because we know how important those are to stop the spread of disease. But I can tell you that all of our case investigations are important because they represent people. They're not cases to us, they're people. And we know how divisive this has been, but our team just treks on every day. This is our COVID-19 in pictures. What this represents over here in the yellow, these are all the labs that come in, and this isn't total. This is probably, each one of those is a day. This is our part of our data management team. This is what comes in every day. And before we can even start a case investigation, this is what the data management looks like, which is a huge piece before a case investigation can even start. Right in the middle, all those boxes, those are positive cases. And again, these are lives. These aren't cases to us. This represents every single person in Chambers County, which is important to us. This is our EPI team right here. Starting to the left, this is Sarah. She's our lead EPI investigator. Jessica is one of our contact tracers. Lena is our PhEP EPI investigator. She's a grant-funded position currently. And then we have Sabrina Trahan, who's also a contact tracer. They're very important, very integral. They work weekends, holidays, nights, and couldn't do it without them. So this is part of our public health emergency preparedness grant funding. So I just wanted to talk about this because this is part of the big reasons how we function. So Kevin and Paula, their salaries are partially grant funded. Our PhEP planner, Susie, she's 100% salary grant funded through March. Ashley is our first responder vaccine coordinator. She's 100% grant funded through June. She's currently our lead data management intake coordinator, only because the vaccine project has been put on hold because of in-person, but she still is working on the vaccine program. Lena is our EPI investigator, COVID EPI investigator. She's 100% grant funded through March. And then Sarah is our EPI investigator, and she's county funded. And again, I want to tell y'all thank you for allowing us to have that and how important it's been to our program. This is a breakdown of all of our grant funding. And just to reiterate, over the past 4 years, we have secured over $1.1 million in grant funding through the CDC and DSHS. And this is a breakdown of all of our projects. Vector control, a lot of this was crisis coag after Hurricane Harvey they've moved these funds forward. And so we're still spending these dollars. Cold chain management, COVID-19 grants 1 and 2 are currently still spending. And the CPS and the city's readiness initiative grants, those move forward every year. Salaries we have listed over to the right. And this is, these are currently salaries we're operating off of. This is a breakdown. So our the CPS hazards and CRI grants, they're matched at 10%, but we match them by existing salaries throughout our public health department. Currently, the county funds 16% of all of our FEP salaries, and the county funds 7.6% of the overall FEP funded projects. The remainder is funded by DSHS grants. So this is some of the projects we've been able to do by the FEP grant funding. Our immunization project, which I'll discuss in a second, 2 generators. One of them is over at our FEP and emergency management warehouse. One of the generators is over at the Winnie Annex. This right here over to the right is our wireless data logger monitoring system on all of our refrigerators and freezers that we can monitor wirelessly, which we must have for our vaccines. We have vaccine refrigerators, vaccine freezers. They're all new. They're all at the health department clinics throughout the county and at the warehouse. And then these are our portable storage refrigerators and portable refrigerators and coolers. The crisis coag grant funding total amount was $651,000. I've got an airplane and then a GPS monitoring system. This is what Lawrence was awarded through our crisis coag funding. And I know that that was an integral part to the vector control. This is Ashley. She was hired as our first responder safety and health. DSHS saw a need that our first responders needed to be vaccinated for hepatitis B and Tdap. And she worked extremely hard from January until the pandemic started in March to be able to vaccinate our first responders. And the funding for that project was $143,000. That project was also moved forward. So this is basically what they did. Was the survey was sent out to all the county employees. To date, 78 still need Tdap and 120 have been identified to receive hepatitis B. But our compliance rate has been amazing. Sheriff's Office, 120 employees, 95% are up to date on Hep B, 95% are up to date on Tdap, and 98% are in MTRAC. Building maintenance, 100% are up to date on Hep B, 94% are up to date on Tdap. Parks, 89% on Hep B, 94% on Tdap. And again, these are identified as first responders in a time of a hurricane or flood or in response. Others that she's vaccinated through the project, EMS, indigent healthcare, emergency management, and several of the commissioner's offices. And we're not through with this. When the pandemic, this is a position that's been rolled forward. Again, this is truly important. And what something else she's working on is helping offices work on new hire vaccination policies. So when a new hire comes on, making sure that they're vaccinated before they even get hired onto the county. Again, some of the other things that she's worked on is presentations through all of these community health partners, whether it's a hospital, other county offices throughout the LEPC, Baytown Fire Department, and Mont Belvieu Police Department. All of these departments are considered first responders, and we understand that they need to be vaccinated so they can respond in the time of a hazard. We partnered with Bayside and they decided to supply vaccines and waive all co-pays for Chambers County employees who have insurance. And they've created amazing databases for all of our first responders throughout the county. Susie is our public health planner. So she plans, trains, and coordinates and facilitates all of our plans and exercises, working closely with emergency management. These two things go hand in hand, and she's only been here since September, but these are the plans that she's already updated and created since she's been here. Right now, we're working hard and heavy on the COVID vaccination plan and the distribution plan. And this is also a COVID grant in the amount of $126,000 that we're currently working off of. Some PhEP response activities, and I know that y'all are all aware of these. We had several drive-through testing sites with some amazing partnerships, and we've also performed several flu drive-through clinics this year. Other PhEP activities that we do, not just this year, but in years past, all of our pod exercise trainings, we partnered with Mont Bellevue School this past year to do a regional exercise, SNS coordination, our TDAP clinics, grant management, shelter coordination, all of our hurricane preparedness and response, our ongoing disease surveillance, and our community partnerships to bridge all of those gaps. So right now, what you'll hear a lot about is we're supposed to receive 1,000 doses of COVID vaccine this week. Not just Chambers County Public Health, but there's several identified hospitals as well as pharmacies that will be receiving vaccine. And what we are working on is the phase 1, vaccinating all of the local healthcare providers, the first responders in this phase 1. So a press release will be going out today. We're currently working and partnering with all of our local healthcare providers in vaccinating those. DSHS has an EVAP, or an expert vaccine allocation panel, who pre-identifies those in the phases who will be vaccinating. So we will use all means and tools available to communicate who will be identified next in those phases. And we will continually reach out to all of our elected officials and our community partners and let them know when it's their time to be vaccinated. We know that limited doses will be available initially, and as we are reallocated doses, and as those are available, again, we will reach out to all of those. So I just wanted to share some pictures. Again, I put like a little disclaimer down at the bottom. A lot of these pictures were taken before masks were, there was a mask order, or a lot of these pictures were taken before the pandemic started. This picture in the middle means a lot to me. This is taken on day 1 on March 13th here in our operations center. But these people have worked really hard. A lot of you may find yourself in some of these pictures. A lot of these are just pictures representing some of our social media posts. A lot of these just pictures are from hurricane response in our EOC, our public health team, and we just couldn't do it without everybody. I can't name everybody because I'll probably get choked up. So this is our EOC. Judge is juggling here some of our press conferences. We've had a lot of partnerships. So yesterday I received in the mail, this is Senator Creighton Techo has been an integral part of our partnership. Received in the mail a flag that was flown over the Capitol, was sent to all the public health directors, and a resolution for all the public health departments and all their hard work. So I don't know if y'all can see me, but here's the flag that was flown over the Capitol. So a big thank you to the entire EOC, the Commissioner's Court, everybody listed there. So there you go.
Great job. Very informative. And you saw that's my job is juggling things. So my mom and dad said that's the only thing I learned in college, but was how to juggle.
I'm not going to ask what you were juggling in college.
Thank you. No, great job, Mary Beth. And you guys have done a really, really good job, and keep.
Thank you, Mary. Thank you, Mary Beth.
Most of us do not understand what y'all are doing. So I think that helped tremendously explain that. All right, questions? Commissioner.
Yeah, I got a quick question. About the first or second slide you showed was showing immunizations, and I couldn't help but to notice how few were actually done in Mont Bellevue versus Anahuac and Winnie. Any reason why they're not doing it in Mont Bellevue?
So really good question. So the TDFC program is for those who either have Medicaid or uninsured or underinsured. So those are the only ones who qualify for the TVFC program. So a lot of times, it just depends on your population you're serving.
Sure. Okay. Thank you.
That makes sense, Mary Beth. I get that now. Thank you.
Hey, Mary Beth.
Yes, sir.
I appreciate the great job y'all doing. I know it's very stressful, but y'all doing a great job. You see on the news now, they're talking about this second strain that is more contagious than the first. What's the word on that y'all are getting?
So I have not attended a conference call about that yet. All we're seeing is just a little bit of tidbits we're receiving, but I have not listened to a DSHS conference call with Dr. Schufert yet. But if I find something out, I will definitely forward that to y'all today, regarding that.
Thank you, ma'am.
Oh, yeah, and I said that. Yeah, thank you. I know that I talk extremely fast and I have a lot of stuff going on in this brain, but I just want to say, if you have questions about vaccines, I was looking at the slides going through there, but we're working extremely hard on vaccines. We're going to ensure that everyone will be vaccinated. The state is allocating those doses, through the phases, but we have collaboration through our county like none other, and we will make sure that those vaccine doses are allocated like they should be, and we will reach out and we will partner with and make sure that everyone is vaccinated in due time, and we will send out press releases and reach out. So
Now we're gonna do them with this first round. We're gonna get all the first responders. Or when are we gonna possibly do drive-throughs on that? I mean, is that down the road a little bit or what?
yes, so that when the general public or those, when they're allocated and we have, an increased supply of vaccinations, that'll definitely be drive-throughs, and those will be partnerships with hospitals, public health, and, and that'll all be released.
Thank you, ma'am.
Thank you. I appreciate it. All the support.
All right, anything else? Gary? Nothing?
Not sure I could pronounce it.
Good one.
Get ready, Mary Beth.
It's Mary Beth. No kidding. All right, thank you. Great job, Mary
Thank
Beth.
you, Mary Beth.
Let's go to 1.2. Discuss and consider recognition by Governor Abbott commending the Texas Association of City and County Health Officials, TACO, and all local public health authorities, departments, and districts in Texas for the dedication and devotion to protecting the health and well-being of Texans and answering the call to face the challenges of the novel COVID-19 pandemic. And Lauren has offered to read that resolution.
As Governor of Texas, I commend the Texas Association of City and County Health Officials and all local public health authorities, departments, and districts in Texas for their dedication and devotion to protecting the health and well-being of Texans and answering the call to face the challenges of the novel coronavirus pandemic. In response to this crisis, the men and women of the Lone Star State got to work. A coalition was formed comprised of TACO and the member associations of local public health authorities, departments, and districts. Since its inception, the goal of this dedicated group has been to provide rapid and essential support to local communities. TACO members were immediately dispersed to the front lines of the COVID-19 response and began providing day-to-day services to their local populations by promoting healthy lifestyles and disease prevention and protecting against all potential health threats. This disaster has created many new challenges for local public health systems. TACO has helped relieve this strain by disseminating information on the coronavirus and how to protect yourself against it. They have also established COVID-19 testing sites and provided contact tracing in communities in order to contain the rampant spread of this virus. In Texas, we know that it is not our challenges that define us, but rather how we rise above them. And this sentiment has never been more true. It is my pleasure to send my deepest appreciation for all of your hard work during this difficult time. Working together, Texans will overcome this challenge. First Lady Cecilia Abbott joins me in thanking you all for your service practices and wishing God's blessings for you and yours during these unprecedented times.
Thank you. All right, motion by Commissioner Nelson,
Second.
second by Commissioner Gore. Did Mary Beth get off?
Yeah.
Well, and I will say that, Lauren, it has been it's been a really good relationship between the state and all our other partners. So great job. Those in favor?
All right.
Opposed? Motion carries. 1.3, approving the official results for the December 12th, 2020 City of Baytown runoff election.
Yeah, Judge, I will verify that I checked that the reason that the two council members didn't get any votes on that one election was because it wasn't in Chambers County. So,
Yeah, actually, there's part of the precinct in Chambers County, but nobody lives there.
yeah, so I'll make a motion to approve.
Lauren, motion by Commissioner Nelson,
Second.
second by Commissioner Combs. Those in favor?
Aye.
Opposed, the motion carries. 1.5, discuss and consider setting county judge's bond pursuant to Government Code 26.001 in amount not less than 100,000.
So moved, Judge.
Motion by Commissioner Nelson, second by Commissioner Tice. Those in favor? Opposed, motion carries. 1.6, same thing for the new county court at law judge.
Motion to approve.
Second.
Motion by Commissioner Nelson, second by Commissioner Tice. Those in favor? Motion carries. Okay, we're close to getting there. 1.7, discuss, consider approving the purchasing agent to acquire bonds for the preceding two agenda items with effective date January 1, 2021. Motion by Commissioner Nelson,
Second.
second by everybody. Second by Commissioner Tice.
Commissioner Combs beat me, Judge.
All right, Commissioner Combs. Those in favor?
Aye.
Motion carries. 1.8, discuss and consider extending the January 12th, 2021 deadline, given the purchasing agent to return with sealed bids for the sale of Victoria Walker Park to January 26, 2021. Billy, this, I know Scott talked to me about it and that you need that extra time, right?
Yes, sir, I would. Some people just won't be able to look at it that quick.
Okay. Motion by,
Motion to approve.
second by Commissioner Combs.
Second.
Those in favor?
Aye.
Opposed, the motion carries. Where's, is Sam's in? Okay, yeah, let her in. Morning, Sam.
Morning.
Okay, there you are. All right, we're going to Economic Development Tourism, 5.1, discuss and consider approving task authorization number 2 for Freeze and Nichols Incorporated related to the development and submission of the Texas Water Development Board Flood Infrastructure Fund application submitted October 19, 2020.
Yes, sir. So this task authorization is for the actual development of the application that was submitted to the Texas Water Development Board's Flood Infrastructure Fund. As the judge knows, I think several of you know, we actually did receive this grant. We got notice at the end of last week that we were approved. We were actually ranked 4th in the state as far as applications go, which is a huge accomplishment, especially because we had no additional requests for information and we were unique in that as far as the state goes.
What's the amount of the grant, Sam?
It's right at 6.2 million, if I'm not mistaken. I can pull that number for you right now.
Go ahead.
That's amazing.
Congratulations on
Yes.
4th in the state.
Congratulations on that. Now, would you mind just elaborating on what this grant's going to be used for so everybody will know, please?
Sure. So this grant is going to be used for the creation of a virtually countywide drainage study. So what Friesen Nichols is going to do is work with the city of Mont Bellevue, the county, Liberty County is involved as well, city of Dayton, city of Liberty. We're working all together to develop a comprehensive drainage study that's going to help us identify any major areas that we need to work on, how the water flows to and through Chambers County, and will be the foundation for developing any drainage plan moving forward. We're also going to loop in kind of the study area for y'all's discussion of creation of a drainage district on the west side of the county. So we are in a way killing two birds with one stone, if you will.
Yeah, this is everything excluded what Trinity Bay.
Correct. The only thing it's not covering is basically Spindletop Bio, which Trinity Bay has completed a study on. But we will.
So it's part of Trinity Bay's territory,
Correct.
but not for Spindletop East, right?
Yes.
Correct. And this engineer will lump in that study into one deliverable package for us to have a comprehensive study. So we're going to get that data from TBCD. And even though they didn't complete the actual study, they're going to include that in the assessment of the county's drainage.
Okay, and I know the judge worked hard on this here as well as you, getting the other entities this was a match from other entities and getting them all involved to help be a part of that match.
Right, yes. And we're working now. We were kind of waiting to make sure that we were going to get the funds before we moved forward, but we are starting the process of developing interlocal agreements. This is going to be a complicated process because not everybody's area of study is going to be the same size. And so we have to develop the actual study parameters and then pinch off percentages for each individual entity from that. And we'll base match percentages off of that. We are in the process of that though. And every entity that's agreed to partner understands that they will be expected to share in the final match that we have to pay. Now, the match is paid on each individual invoice once we receive the official contract and begin the project. So the match percentage that the county will be expected to come up with will be paid in a percentage. So you won't by any means be expected to come up with $500,000 all at once. It'll be paid little by little. And I don't have the final number on what our percentage is yet, because like I said, we have to develop the study area. I do know that the city of Mont Bellevue and their engineer is going to take on roughly 40% of the study. So at least 40% of the match will be handled by them.
Right.
What's
And
our
they're
time?
taking the lead on it too, correct?
They're taking the lead on that study area and kind of directing the depth of that area. We're all working really closely to get together to make sure that all of our needs are met.
What's our time frame on
It's a
completion?
24-month contract. So within 2 years, we should have a completed deliverable for you guys.
And
Thank
we
you.
have a very good engineer on it also with Friesen Nichols.
Yes, I've really enjoyed working with them so far. They're very easy to work with, really easy to get a hold of with any questions that we've had along the way. Very, very knowledgeable. So they've been a pleasure to work with so far.
Great. That's fantastic news.
Great news, Samantha. Thank you so much for your
Thank
efforts and
you.
work.
Yes, thank you.
All right, so you need a motion on number one or just
I
on,
need a motion. Yes, sir.
So
Okay.
moved, Judge.
so what do you need a motion on 5.1 for?
First, I need a motion for you guys to approve their draw or their request for funds. So right now we're not under the grant. This portion is totally expected to be paid by the county. It does.
Okay, well, all right, so 5.2 is discuss and consider authorizing the payment.
Right. So the 5.1 is just approving the task authorization, and 5.2 is approving payment.
All right, I'll entertain a motion
Motion to approve.
of them by Commissioner Nelson,
Second.
second by Commissioner Tice to approve authorization on 5.1, approve the payment on 5.2. That covers it, Sam?
Yes, sir.
All right, any questions? Those in favor?
Aye.
Opposed? Motion carries. Thank you, Samantha.
Yes, sir, y'all.
Oh, yeah.
So-
All right. Well, thank you anyway for those things.
You're welcome.
Discuss and consider fund purchase of 5 new playground units in precinct 1, 2, and 4. Sam.
Yes, sir. So this kind of started a long time ago. Back in the summertime, I was approached by a different entity. What I'm asking for is for Craftsman. But I was approached by an entity called Game Time. They had some grants available for playground equipment. And so I kind of got to looking at areas that I felt needed some playground equipment or improved playground equipment. And I talked to a couple commissioners. And then it kind of died on the table whenever we put the moratorium on spending. So I didn't press for it at that time. So those grants kind of went away, but Craftsman had some really great discounts on playground equipment that would have been basically equal to the grant that we would have been able to get. And so Kirk and I talked about the areas that he felt playground equipment was needed. And these are just small units, but basically what we came up with was Gregory Park and Stoll, Double Bio Park, Hancomer Community Building, Beach City Community Building, and Cedar Bayou Annex. And I've talked to, like I said, a couple of you guys about this. And so I just went through and developed a little presentation. You know, I didn't want to write a research paper on why playgrounds are important, because I think we all know they're important. But and I took pictures of the existing equipment, and Kirk took some pictures as well, so you could see what's there or not there. But I really think with COVID and the way the world is now, we need to have more safe play space for kids in our communities. And this is a great way to get a lot of bang for our buck.
Questions?
I guess the reason you didn't find any precinct 3 because I was lamed up.
I heard you were up.
I'll make a motion.
Motion by the lame duck,
Second.
second by Commissioner Gore. Question?
Hey, so if we all want, we can keep looking. We can find more places for playgrounds. I'm all about playgrounds for kids, especially because I have a 5-year-old and a 2-year-old, and the more I can get them out of my house, the better off I am.
We'll add a playground, Gary, to the new West Side Complex. How about that?
That's what I was just getting ready to say. He's got one coming.
Yeah.
Hey,
Those in favor?
Samantha,
All
Yes,
right.
sir.
Samantha,
Yes, sir.
we need to go ahead and get with George and get him to issue that PO, because I mean, it's time sensitive on this here.
Yes, sir. I talked to him yesterday about it. We got him all the numbers and everything, so we should have a PO ready to go by this afternoon.
Thank you,
Great,
ma'am.
great job.
Hey,
Yes, sir.
And all those in favor, yes? No. All right, Sam, is that all you got?
I've got my grant update, but that's pretty self-explanatory, so I don't have
Okay.
anything else I need you guys to take action
All right,
on.
thank you, man. Merry Christmas.
Merry Christmas, Samantha.
Bye, y'all.
Bye.
All right.
And then-
bye. BJ, you there? All right. Okay, we're going to 5.4, discuss and consider Floor and Decor Outlets of America Incorporated tax abatement application. Good morning, BJ.
Morning, Judge. Good morning, Commissioners. This is an application presented by Floor and Decor Outlets of America. Their project in Cedar Port. As you know, the court has approved the proposal for incentives on a competitive project. So this is simply the administrative step to present the application for approval by the court and request the establishment of reinvestment center. Just by way of reminder, this project is going to be a 1.5 million square foot facility. The competing sites were Baltimore, Maryland, Savannah, Georgia. They anticipate the creation of 86 jobs initially, and in 5 years of the operation, about 136 jobs.
This project's been worked on for quite a while, hasn't it, BJ?
Yes, it has been. It's been long-standing, competing against sites locally in Harris County, Chambers County, but Cedar Port went up. But it's been in the works for quite some time.
Commissioner Nelson?
Yes.
I'll second it.
Second by Commissioner Combs. Questions for BJ?
I just want to thank BJ for working hard on it. This is a very nice project for everyone in Chambers County, and I'm glad we got it.
BJ, real quick, you said it, but it broke up. What's the total amount of employment we're looking for at the end of this project on permanent?
Did you say employment, Mark?
Yes, sir.
86 full-time jobs, first phase. BJ, is that what you said?
Yes, Judge, anticipated startup in 2022, and then 5 years into the operation, a minimum of 136 jobs. They anticipate at full build-out, the highest number of jobs at 182 jobs.
That's good.
That's a big deal.
Now this,
And the inventory tax on this one's going to be a good one too.
Yes, that's a very good point. Just wanted to share, they anticipate annual flow through, they're going to be serving 10 states from this location. So the annual flow through of inventory is 200 million, but the
Wow.
estimate of inventory is at 40 million. So that at minimum, if in fact the current tax rate is maintained, it's $216,000 of annual revenue from inventory alone.
now this here is going to diversify some of our growth within this county, which is very good.
Yes, the Chambers County is emerging, with the addition of Floor & Decor, IKEA, Home Depot, Walmart, and others soon to be announced as a significant player in the domestic and global logistics and supply chain sector.
Thank you.
Really exciting, Judge.
I know it is, and I appreciate the hard work, BJ. I got a motion and a second. Those in favor?
Aye.
Opposed? Motion carries 5-5. Discuss and consider Floor & Decor Outlets of America reinvestment zone application. BJ.
Thank you, Judge. This is simply a request to conduct a public hearing to establish the reinvestment zone for Chapter 312. The project's going to be located on 99.7 acres in Cedar Port, and the request is to hold a public hearing to designate the reinvestment zone on the court held on January 12, 2020.
So moved.
Motion by Commissioner Nelson.
Second.
Second by Commissioner Combs. Any questions? Those in favor? Opposed? Motion carries. BJ, I think that's all you got?
Yes, Judge, if I may, I just wanted to add to the prevailing sentiment that's been expressed related to Commissioner Nelson.
Ron?
Time on the court almost mirrors my time here at the foundation. We at the foundation obviously appreciate the support he's provided, but on a personal note, really appreciated the working relationship we've had with Commissioner Nelson. Wish well whatever endeavor he pursues in the future.
Thank you, BJ.
Welcome.
Yeah, I think one of the things he's going to do in the future is he and I are going to have a 2-week quarantine every year in September.
The video. Please share the video.
BJ, thank you so much, and a Merry Christmas to you and yours.
Merry Christmas, BJ.
Thank you very much.
Take care. All right, we're going to 10.1, but Lauren's trying to get Ron on the phone. Oh, you got him? Hey, Ron.
Hey, Judge, I'm going to slide out.
All right, Billy. Glad to hear Patricia's doing good. Give her her best.
All right. Merry Christmas to everyone.
Merry Christmas to you.
You as well. Be safe.
Anything, Billy, let me know.
All right. Thanks.
All right, take care. All right, for the record, Commissioner Combs is gone. And we'll go down to Safety Emergency Management, EMS, 10.1. Discuss, consider approving 3 full-time paramedic positions for Chambers County EMS. Ron Nichols is on the phone, EMS Director. What's your title, Ron?
Morning, everybody. So when we initially did our
Springtime.
budget back in 2019, October 2019, and we discussed with all commissioners and the judge, we decided to help us reduce the budget a little bit. We budgeted for a significant amount of part-time employees. which was a great thing to give the people that were in town, the people that had worked at Anahuac and Trinity Bay, the opportunity to stay part-time and get full-time jobs, and give us access to keep appropriate staffing levels for Chambers County EMS and keep it a minimum our 2 trucks and our supervisor on duty every single day. As everyone knows, and everyone's been dealing with for the last 10 months, COVID-19 has created some pretty unique challenges in the EMS industry, public health community, and everybody else. For us, every time there's a wave of COVID-19 across our region, EMS services restrict part-time employees from working. So as on top of that, you have your quarantines, you have your potential possible COVID-19 or your contract COVID-19, which luckily we've done really well, and we've had two of our employees, both part-time, that contracted COVID-19, and that's it. So we've been able to modify that and not quarantine as much and do some other things to help prevent and protect our employees. What it causes is it causes us from time to time to go down to minimal staffing of 2 trucks and a supervisor on duty, and we end up doing that, paying with significant amounts of overtime, or myself will come in and cover that slot, which is, causes me to have my, flex time that I've got to take. Currently, I've got 167 hours of flex time that I currently have because of this, for me doing different things on the truck and covering as a supervisor for the day so we can keep our staffing levels up. And it alleviates me from having to mandatory my employees to work when they really don't want to, especially around the holiday time. So I worked with Aaron pretty closely last week, dissected the budget, and the request that I'm putting in is that we transfer some of that part-time budget that we have. We initially had $480,000 allocated for part-time employees, which covers 50 paramedics every single day, 24 hours a day, 7 days a week. Reduce that down to 240,000, which gives us 240,000 left over, and put that money towards hiring 3 full-time paramedics. 3 full-time paramedics gives us 2 trucks every single day, a paramedic on both sides of the river, mobile intensive care unit, plus a supervisor and an assistant supervisor on duty, which gives us access to 3 trucks every single day without question, without having to guarantee part-timers. I know y'all seen all the payroll change forms go throughout the Commissioner's Court for the last several months. Currently, we have 21 part-time employees. Out of those 21, only about 6 of them are allowed to work, right, because of the restrictions. And so we're having a hard time maintaining staffing. And so what this allows us to do is allow us to make sure we maintain staffing. And as far as budget-wise concerned, it increases our budget for 2021 by $52,000. However, now that we finally have our revenue coming in, we're more stable. We're collecting about $30,000 a month in revenue, $30,000 to $35,000 a month in revenue, even with our call volume being a little bit down and fluctuating. Myself and Eric, we adjusted the revenue line item from $50,000 to the $100,000, which basically offsets the budget because we know for sure that we're going to collect, $100,000 pretty easily by March or April. So that'll offset the budget too, so it doesn't really actually cause a budget increase and doesn't cause us to spend any additional funds.
Questions?
Judge, those people aren't ready to be hired. Are they going to be open positions? Or he's already got somebody picked out for them?
So currently we have 3 full-time or 3 paramedics that are part-time. 2 of them actually work for Liberty County EMS. And if you didn't know, Liberty County EMS lost their contract with Liberty County a few weeks ago. And those guys were all basically, their service was shut down. They don't have any jobs. So that'll give 2 of those we'll give them the option for a full-time employment and just upgrade to full-time. And in the 3rd position, there's another part-timer that might be interested as well. So there's a good chance that we're basically going to take 3 of the paramedics that already work for us, that have worked for us part-time, that already are pretty much trained and know what we do and how we do things. And they'll basically just transition into a full-time employment like we did with Mr. Morris and Mr. Barth a couple months ago.
So Liberty County EMS is not actually a county-run EMS, correct?
Correct. Liberty County EMS is actually a private, not-for-profit, just like Anahuac and Trinity Bay was. It was contracted through the county to provide EMS services. They were not actually a county-running EMS service.
Okay.
So Ron, nothing's changed based on our conversation we had last week in discussing this, correct?
No, sir. At this point, nothing's changed. Like I said, the budget's not going to be any different, and the plan is to hire those part-time employees if they're still interested in coming on full-time. So there won't be any lapse in training or anything like that. And basically they'll just transition from working 24 hours a week to a full-time schedule, working our normal 48-96 rotation, and be assigned to a shift with whatever supervisor they're assigned to.
Ron, could you?
Hang on. Well, finish up, Ron. What were you saying?
Mr. Jack Kelly is one of the medics with supervisor of the county that's interested in coming on full time. I think he still has 2 more training shifts he has to go through as far as his ride outs, and he'll have those completed before we transition to the full time. And I'll have the names and the payroll change forms ready for next quarter agenda if you guys approve it.
Mark, you had a question?
No, Judge, I believe he's covered it all. I was kind of wanting Ron to kind of touch a little bit what he's been through here. If Gary and everybody isn't aware with the overtime, and it's just been a nightmare with people out with COVID, and it's been.
At one point, we had 7 medics. All at one point, we had 4 full-time and 3 part-time, and these are 3 of our part-time employees that work 24 to 36 hours a week on a regular basis. We're all on quarantine at the same time, which caused some unique challenges. And it's been difficult staffing and continuing to staff the ambulances and paying out overtime. We usually have 1 or 2 people on overtime every single shift with quarantine and with the lack of part-time employees to make sure we keep our minimal staffing in order. And so this won't allow us to reduce our overtime, but also reduce some of the stress with the medics from having to work the additional overtime. You know, everybody likes their time off. Everybody likes their time with their families, so they're having to put in a little bit extra work. And what it'll do also is it also gives me additional full-time employees to cover. So next year when medics do start getting their vacation, because all of our medics will start getting their vacation kicking in January and in March, then we'll have the additional staffing that's already in place to cover that vacation time so that COVID-19 doesn't reduce them from taking time off with their families if they choose to do so. And with our contact tracing, working closely with the public health team, we're right now, we have a minimum of 2 exposures every single day. Now, they're mild exposures for all of our medics. They wear their full PPE. They've got their gowns, their face masks, their goggles on the whole 9 yards. So it's considered a mild exposure. But with the Ryan White law and the other laws that regulate how we do investigations and exposures, we're required to track every single exposure from start to end. So I think currently, right now, just for example, just this weekend, we had 5 different exposures with patients that were transported that were positive COVID-19 patients that we're dealing with and doing the constant contact tracing, working with the hospitals and providing that information to the public health department. And it's just, it just provides some unique challenges, the same challenges that other department heads have to deal with. For us, it's just a little bit more stringent because we are on the front line. My guys are seeing this on a regular basis every single day. They're dealing with constant contact with patients that either potentially or do have COVID-19. So it's also increased some of their stress level as well. So anything we can do to reduce some of their stress, help with some of their mental health, and just help them feel a little more comfortable is a benefit to my entire team. Those guys have done a great job. We slammed together an EMS service in the middle of the pandemic, brought in a bunch of different personalities, a bunch of different people with different experience levels from different services from around the state, realistically. And they've done a fantastic job of maintaining and creating, in my opinion, one of the best services in Southeast Texas. We've got really aggressive protocols, and we've got some really top-notch medics with over 500 years of experience between all of our different shifts, which is pretty phenomenal compared to some of the other struggles that other EMS services are going through. And my guys are, even with all of that, they're still happy. We're still family-friendly, family-oriented type service. And they're all having they're all dealing and managing with the stress and still managing to have a good time and enjoy what we do, which is hard to do sometimes, especially during the height of this pandemic.
Hey, Ron.
Yes, sir.
I see you have it here that it take approximately 2 months to get the medics through training, released to work the units on a regular schedule. What's the difference of working a regular schedule and then what they're doing now? I mean, why does it take 2 months to get them online?
I could barely understand you, Jimmy. Judge, could you repeat what he was saying?
Yeah, I wasn't paying attention. Sorry.
What's the 2 months schedule to get them up to speed if they're already working with our EMS now?
So basically, just per the state and per our guidelines, we're required to, that was if we have to hire full-time employees from the outside and go through the interview process. Every employee is required to go through an orientation process, which includes 2 to 3 days in class, plus a minimum of 7 to 10 shift rotations, 24-hour shifts, to make it through our training process. And that's a requirement to the state. So if we have to hire somebody from the outside, which at this point I don't think that's gonna be a problem. But if we had to basically post those positions and hire from the outside and hire brand new, that would cause the staff to put them through an orientation and training process, which could take up to about 2 months.
Okay, that's,
They work 48 hours a week basically. So they have to ride 10 shifts. That's 5 shifts. That's 5 weeks at a minimum, plus their in-class training as well. So it can take up to 2 months to get them completely through the training process. But like I said, if we're able to hire those part-time employees that want to come on full-time, that alleviates a lot of that. They'll be ready to go, by the middle of next month once it's approved in Commissioner's Court.
okay, that's fine. I mean, and I understand it won't cut down on built-in overtime because you have so much overtime built in the schedule as it is. But
Right.
it should help on the other overtime. And I mean,
It'll like I said, it increases our budget a little bit, and it also still provides us that part-time funding to keep 1 or 2 part-timers on duty every single day. And so all those people that have been working with us throughout the entire process during the pandemic, it won't cause them to lose any of their hours as well. So it still takes care of everybody, the part-time, and gives us the full-time without increasing our budget or costing us any more money. It'll reduce some of our costs and overtime and things of that nature next year. Of course, all pandemic and driven based on all of that. It all comes.
can you elaborate just a little bit for everybody out there that's listening that we had not, I mean, I know Winnie EMS is doing good, but I mean, there's a lot of counties struggling.
So one of the
EMS.
great things about you gentlemen approving Chambers County EMS in October, one of the struggles we had towards the beginning of March of this year, at the start of the pandemic, was that because it was new, because nobody knew what was going on, most full-time employees, including us at Chambers County EMS, restricted their part-time employment. So they restricted their medics from working other jobs outside of their full-time job, just because to limit the exposure and try and help figure out what was going on with the virus. For us at Chambers County EMS, luckily getting our license the way we did and kind of putting everything together in the height of the pandemic, had we not been in that position, I think, especially for Anahuac and especially in Trinity Bay or Cove, they would have suffered. For example, in Cove, all of their employees, with the exception of 2, were part-time employees. So now they're all restricted from working a second job. You wouldn't have nobody to cover those ambulances. And same thing in Anahuac. They had 4 full-time employees, and 4 full-time employees can't cover an ambulance 24 hours a day, 7 days a week. So it would have caused some pretty significant restrictions for us. And then with the disasters and the potential disasters we had with Hurricane Laura, Hurricane Beta, Hurricane Delta, because we had the full-time staff that we had at Chambers County EMS, we were able to make sure that all 4 of our ambulances were staffed in preparation for anything that may have happened during the storms, and ensure that we had adequate staffing to make sure that the residents of Chambers County were going to be taken care of regardless of what was going on with the disasters, the pandemic, and everything else. And it's been a huge benefit for the Chambers County for that. And then also, now that we have Chambers County EMS and Winnie EMS, when we've all worked closely together, Winnie to doing really good over there. We have the same medical directors, the same protocols. So we have the same continuation of care at any part of the county that you're in. You've got the same treatment modalities, the same aggressive treatments that we have for a rural type EMS environment that covers the entire county versus having 3 different medical directors, 3 different sets of protocols, 3 different sets of policies and procedures. Now, Chambers County EMS and EMS are on the same line when it comes to the policies and procedures and when it comes to the protocols and the treatments that we can provide to our patients, which are all very aggressive compared to some other services, just because of the nature of the rural environment that we're in and the delayed transports, the distance we have to the hospitals. We have to be a little bit more aggressive with our patients and have little and better opportunities to treat those patients than you would have in a municipality type environment.
So I guess you do, you realize when we're looking at creating the Chambers County EMS, we had also considered contracting with Liberty County EMS. And I don't know the issues between Liberty County and Liberty County EMS, but it looks like we went in the right direction. Commissioner Gord, you want to say something?
Yeah, I would like for you to elaborate just a little bit because, I mean, I think it was your forethought that got this tax put in place to be able to have this funding mechanism for this EMS years and years ago. So I don't know if, I'm guessing everybody knows that this doesn't actually come out of our general fund. It comes out of the special tax that we collect.
Yeah, health services sales tax, and it's basically what it's for. And when we got that created, that one of the main reasons we did it because of EMS, and the lack of reliable. And it wasn't that we didn't have good volunteers. It just, as we grew, the volunteers couldn't keep up with.
Judge, that obviously didn't happen in the last 24 months I've been in office. When
No.
did you implement that?
We got that approved, got it voted on and approved. I don't know. It's been
I think it was
10,
in 2001.
2001. I was going to say 10 years ago,
Wow.
but years ago.
Good thinking, Judge. Thank you.
Hey, I have a good one every now and then.
There you go.
All right, I'll entertain a motion by Commissioner Nelson,
Motion to approve.
Second, Your Honor.
second by Commissioner Tice. Those in favor?
Aye.
Opposed? Motion carries. Thank you, Ron.
One more thing, 'cause I know you haven't got to it yet, just because I'm on the phone.
Go ahead.
I've got 19.9 as all the funding agreements for the fire and EMS departments that have turned their funding agreements in.
Mhm.
When you get to the consent agenda, I just, mind going to that agenda item in case you have any questions.
Approved 1919 approved 2021 funding agreements, Winnie Stoll EMS, Mont Belkey VFD, Oak Island Double Bow VFD, Old River Volunteer Fire Department, Smith Point, Wallaceville, Winnie Stoll, Chambers County Water Rescue, and Cove Volunteer Fire Department. Any questions on, anyone have any?
Departments for getting those in as quick as they did. We had those packets sent out at the beginning of October, and the ones that haven't turned them in have made contact with me due to some potential leadership changes within their departments. So I should have those for the next court agenda, and then all of the fire and EMS services within Chambers County will have their funding probably by the middle of January, which is a pretty good thing.
So they got them in timely and they're all completed.
Yes, sir.
So good job. Any questions on those? Before we
No, sir.
let Ron go? All right, Ron, thank you. Merry Christmas to you and yours. Take care.
Merry Christmas, Ron.
Okay, we voted on it.
No, I don't think we voted that, Judge. If that's,
No,
we're gonna vote on that item?
Well, I checked it. Let's vote again. Those in favor?
Aye.
Oh, no, are you talking about the?
You're talking about
10-1. Yeah, we'll go to consent in a minute. Let's take 5 minutes and then we'll go to consent agenda. We'll take a recess at 10:50 a.m. Am I unmuted?
Yes, sir.
All right, call come to order. After break, it's 10:59 a.m. Commissioner Nelson. Here's your new Laguna rod. It's right here, Commissioner Gary Nelson. So,
That's good.
Is it 12 foot long?
no, it's 15 foot long.
I gotta have a trailer to haul that other one around.
Judge, get him some 90-pound test treble hooks so he'll be sure and be able to just horse them in.
I told you that one that you got yesterday that's an Old River fishing pole. You moving to Old River.
Well, I had to come down to your place and fish off your pier.
Come on. Anytime. All right.
Gotta wait till I move in there,
Yeah, let's go to consent. Under payroll, I have one to add. It'd be Marangeli Adams. She's going from executive assistant county attorney's office to court coordinator for the county court at law. No change in the pay. So we'll walk that one through. We need to take 24 to executive session per the county attorney. Number 6, payroll changes to executive session. And then we'll have an executive session. All right, Gary, you're first. The questions on the consent.
Well, we just taking them all to executive session, looks sounds like to me.
No, we're not. 6 and 24.
No, I mean, that was.
Oh, the ones you had questions on? Okay.
Yeah. Mine too, Judge.
Gary, this is your last chance to ask a question about a consent agenda item.
Well, I didn't have a problem with it. I mean, the rest of them were pretty straightforward.
Okay,
Just
good.
those two items I thought we needed to talk about.
Commissioner Gore, anything?
No, sir, that was mine as well.
I do.
All right, motion by Commissioner Nelson to approve the.
Judge, I would ask, are we gonna to get another vehicle for the airport? I mean, I noticed you surplusing that little old Jeep that we had out there. I mean, with the
We've got
airport.
a, we've got a
We've
car.
already gotten him one.
Okay, well, I must have missed that.
Came from the sheriff's office.
All right. That
All
sounds
right,
good.
motion by Commissioner Nelson,
Second.
second by Commissioner Gore to approve them all.
Except for those two items, except for the
Except for
two items.
6 and 24. So we're approving them all except for 6 and 24. Those in favor?
Aye.
Opposed? Motion carries. Number 20, executive session, 20.1. Discuss, consider approving negotiated settlement amount for equipment rental repairs occurred during Tropical Storm Imelda. So we will take number 6, 19.6, 19.24, and 20.1 to executive session at 11:02 a.m. So we'll recess out of regular session and go to executive session at this time. All right, court come to order, executive session. Before I forget, let me commend our IT folks, mainly Austin, for this year has been a challenge, virtually courts and, not only commissioners court, but judicial courts. And I'm proud to have some young folks around me that understand what's going on so they can help me out, even if they are lumberjacks. Appreciate it. All right, we're going to, it's 12:08 p.m. We will go back into regular session and go to number 19.6, payroll changes. Commissioner Nelson, you got a motion?
Yes, I'll make a motion. We approve all the payroll changes except the Parks Department.
Motion by Commissioner Nelson, second by Commissioner Tice.
Yes.
All right, questions?
Would that be two motions, Judge, or is that just one? Because, I mean,
It's one motion. He's going to approve them all, including Marangeli Adams, which wasn't in the packet, her transfer that I read earlier. So approve them all except for the Parks Department. All right, I got a motion and a second. Those in favor?
nay, I'm saying, we're saying, go ahead.
Commissioner Gore, go ahead. Jimmy.
No, that's fine. I wanted to make sure, I wanted to approve all of them. Okay, that's fine. Nay.
Okay. All right, so let's go to number 24, which is tabled. That's 1924. Table it for next court. And under executive session, 20.1, discuss and consider approving negotiated settlements. And Mr. Peel has provided a motion to approve payment of $13,500 invoice from Mustang Rental Service for the repair of equipment damaged during Tropical Storm Imelda recovery efforts. Commissioner Nelson, is that your motion? Have a second?
Second.
Motion by Commissioner Nelson, second by Commissioner Tice. Questions? Those in favor?
Aye.
Opposed? Motion carries. Gary, I think you're done. And again, we all love you. And I want you to say what time it is and your last court is adjourned, but you're going to say it.
It is 12:10 p.m. and I am out of here.
Court's adjourned. Thank
Happy
you.
retirement, Gary.
Appreciate it. Merry Christmas to all of you.
Merry Christmas.
Gary,
Happy
I'm
New
on my way to you.